Um, I've always wanted to be a doctor, right? Ever since I was young, I've always wanted to be a doctor. These were my heroes, people who actually shaped what I thought health medicine and healthcare was all about, right? It was not accurate, but these were the people that shaped me. And I graduated from Indonesia. Indonesia was fun. I got to see a lot of the weirdest cases there. Um, I came back. I did my housemanship. In Seremban. I completed my district posting in Simpang Pertang. It was interesting, being in the middle of nowhere, where your town is the size of one shop lot. But it was fun being there. And then 2014, I came back. I was in NS. Was in NS and ICU in Seremban. I actually thought I was going to be an intensivist. I really love like the whole ICU setting, how we actually treat patients there. I really love it. But in 2016, I actually had a slip disc. And when I had the slip disc, I actually asked my HOD at that time to give me light duty. I just wanted some time off, just working in the clinic instead of being in the ICU. I just needed 3 months to recuperate instead of, having to do the heavy lifting. But what he told me was I didn't have a future in medicine and that I should leave. So what I did, I left. Now there's something clearly wrong with the story. I mean, one, obviously there was lack of support for me. But secondly, I played the victim, right? It was very easy to play the victim. I could have done so many other things to stay in medicine, but I didn't. I used this as an excuse to leave. So the first thing I actually want to share and impart on you guys is that you should always know, because the contract system, how they I blamed everybody else for me not being able to become a specialist. But the fact was, I was actually very unhappy being where I was. I wanted to impact healthcare, but I felt like I wasn't impacting healthcare the way I wanted, but I didn't know how to do it. So it was easier for me to blame somebody. That's why I didn't become a specialist. But the fact was, I was actually very unhappy at where I was. So for you guys out there, my juniors or maybe my colleagues, own up to what you want. If clinical medicine is not what you want, be brave enough to say, this is not what I want, and move on. And if clinical medicine is still what you want, but you're still not happy, try to break down what is it about your situation that you're not happy about. If it's not clinical medicine, is it your environment? Is it because you're not in the department you want? Is it the system? So try to break that down to find out what exactly it is.